Afternoon and welcome. I am Dr. Mansour, one of the co-founders of Friends of Bright Minds, along with Husana Diaby. We are a community-based 501c3 organization, and we've been in existence for over 11 years now. We're based in Brooklyn, New York. Our mission is bringing children and families to high-quality educational support services and advocacy to improve student achievement. So that is our mission. And our vision is a little bit broader, is reshaping educational partnerships into thriving, family-friendly learning communities to ensure a better academic global society. So today, we're going to be talking about COVID-19 and the health disparities and trying to explore some viable options and how all this is impacting us with the lockdown. Now, right now, the lockdown is loosening up in certain parts of the country, but we don't know how long that's going to last. So this presentation we're giving today is actually aligned to our mission, vision, and goals. And we want to continue to shine a light on some of the concerning issues of our community and attempting to examine some of the strategies and most of all the solution to some of these issues that we're having. As we know, this deplorable virus is actually still with us. And although there have been aggressive efforts at reopening our towns, our cities, and even our country, because I guess people really want to gain some type of economic footing. But most of us are still trying to abide with the CDC guidelines, which means wearing masks and practicing social distancing, which is about 6 feet between one another. But somehow this still remains a challenge for a lot of us. So we've noticed some very troubling statistics, specifically within the Black and Brown communities of color, where these communities are disproportionately being affected and infected by the virus. So we want to examine the facts from a healthcare perspective and provide viable options into staying healthy during this pandemic. Some of the factors we know that may contribute to this disparity include some structural inadequacies in terms of healthcare, food deserts in certain neighborhoods, denser living conditions, the role that Black and Brown people have in terms of being essential workers, transit workers, hospital workers, people who are really on the front lines. Also people who have rampant underlying conditions and an overall lack of resources. So we're going to talk about this a little bit more. And today we have 3 distinguished guest participants. I'm very happy that they're here with us today and they're going to share a wealth of information. We're really, really happy that they're here with us. So I want them to first introduce themselves, who they are, how long they've been doing what they're doing, and maybe it's a brief outline of what they see some of the problems are and maybe some of the issues. And then after that, we'll field a certain amount of questions from whoever's listening. This presentation is also being recorded, so whoever's not here and who got a chance to miss it, you'll still be able to share it with your constituents or your followers or whomever you work with on our YouTube. So first, we're going to start with Khadija Tutor, and she's going to tell us a bit about herself and her organization and what she's doing. And I see she has her mask on, so she's ready.
I'm going to speak in 1 second, you all. If you can just let one person go before me,
problem. Okay.
That would be helpful. Thank you.
Let's start with Akweevyah. Am I pronouncing your name correctly? Akweevyah Evans-Young?
It's Akweevyah.
Akweevyah.
Yes, that's me.
She's an RN and a member of the North Carolina Nurses Association.
Yes.
She's going to give a little bit of an overview of what she does and what she's doing currently.
Okay. Shalom, everybody. Hello to all the family out there. It's a pleasure and an honor to be on this panel. I am, like she said, a RN in North Carolina and have been doing this for over 13 years now. Currently, I am in the family practice, so I get to work in ambulatory care, or what we know as the doctor's office. With the COVID and everything, it's been a roller coaster ride. A lot has changed. Amongst African American or the brown and the black communities, what I do see is two different extremes from one to the other. It's either we don't take it seriously enough, and there's so many of us that's running around like this doesn't exist, or it's no in between, or the ones that are staying at home, they don't have access, they're not going out, they don't have family and friends to come out, but they're staying secluded in their homes with masks and gloves on in their homes. And amongst mostly the elderly in the African American, the brown, and the black communities that are being affected with the COVID. It's in the office setting, I do see a lot of disparities when it comes to race. Our access, as far as our community, we have very little access to adequate health care, depending on where you're going. And even in the office setting, I get to see how, even with providers and the nurses, with patients of color, they are treated differently. So as far as just being on this panel today, I would like to hear some of the ideas that people come up with as far as what we can do, as far as networking and keeping things, to try to boast and try to help each other out, help our community out a little bit more. I do have some pointers and everything, but I'm just introducing for now, so I'm gonna let somebody else take the floor.
Okay, thank you. We're going to go next. Thank you so much for that information. Very insightful. We're going to go next with Dr. Burton.
Hi, good afternoon, everybody. I'm Dawn, Dr. Dawn Burton, and I'm so glad to be a part of the discussion. I've worked in the dialysis social work role for 12 years, and we do community outreach personally with my husband through a nonprofit organization called Concerned About People since about 2012. So what I have seen in the work that we do, particularly in healthcare for dialysis, we were already required to do a lot of precautions, so that was not very difficult. But as you probably already know from Centers of Disease Control and Prevention, our population is a high-risk population. And when we use that word high risk, one of the concerns about what we know in early research is that persons with hypertension, diabetes, COPD, and other respiratory diseases or compromised immune systems, which all affect the population that I serve. And in the region that I work in, we are talking about at least 90% are going to be Black and brown people. So it was very difficult for us to adjust because, as you know, everyone is learning as they go. So I'm excited about being a part of the discussion. It is needful. It's a great intersection because, as we know, and just like the previous lady shared, is that we need to bridge a gap between what we are knowing and what we learn in our profession and making sure our community is informed.
Thank you, Dr. Burton.
Thank you.
Are we ready yet, Khadija?
We are so ready, y'all.
Okay.
The multitaskingest multitask ever. Give me 1 second. You can sign there. I'm so happy to be with you all while doing all this good work. I'm Khadija Tutor. I'm a massage therapist, a doula, and I own Life Wellness. Thank you, sis. Thank you so much. I'm gonna lock the door and then I'm gonna come back and talk to y'all.
She's actually working out of her place. She has people coming in and out, so we really appreciate her.
So here's the beautiful thing about being in this position in this community. About 5 years ago, I decided that I didn't want to work in doctors' offices anymore doing massage therapy. I wanted to be able to work in my community. So my partner and I my husband, we decided that we were going to open up a massage and acupuncture space in the middle of Bed-Stuy. And a lot of people thought that that wouldn't make sense. And it turns out that this wellness center that we opened up became a bit of an oasis within our community. We're dealing, before COVID happened, with an immense amount of stress, immense amount of the financial disrepair that happens in our community that then really turns into our not having access to good health care, access to good mental health care, created such a huge disparity that when this COVID hit, we were left with this space of like, how do we deal? And so the idea around looking at what is our main issues, like food, not having access to good food, not having access to good mental health care, not having access to the understanding that therapeutic touch doesn't necessarily have to be a thing that is only left for people who are rich. The touch doesn't have to be a sexual issue. It could be something around healing. So we've been really re-educating people even before COVID happened to understanding how healing should be for them. And now that it's here, really being able to have them access herbs and their grandmother wit, the things that you saw your family do to keep you healthy when you were a child, we're now tapping back into those things. We're pivoting our backyard, which was already a wellness oasis in itself, to create a green space where we're growing herbs so people can come and pick up herbs and create medicine for themselves in their home, along with Western medicine. I think if we move from a space of preventative medicine around what we eat, how we treat ourselves, how we treat each other, we'll be able to really function within this new norm that has to happen. So I hope that answered the question.
Yes. Thank you very much. So I'm just going to ask a few questions. I'm going to really pose the questions to particular people on the panel. If somebody else wants to jump in, that's fine. But I wanted to get some ideas from your specific perspective. So Nurse Evans-Young, as a medical professional, what suggestions can you provide to encourage healthy choices or healthy life choices? What can you recommend for us as a community?
Well, the main thing, excuse me, the main thing with any relationship that you have, communication, 100% communication. Start those conversations. Start those conversations at home, in the home setting. Start those conversations in our settings where we have gatherings. I mean, because of the current conditions with COVID, a lot of things we're doing via Zoom or virtual congregations, things like that. But we still have to start those conversations. It's so important to not tiptoe around important topics about our health and well-being. One of the things that we know, like the doctor, I think it was Dr. Burton, who said about our already issues with diabetes and with hypertension and things like that, that are amongst the communities, Black and brown communities, and it hits us the hardest. We have to start from now having those conversations with our families about how to do things to better ourselves and make ourselves well again. It's not too late. You know, so many of us do have diabetes, high blood pressure, and other issues, mental health issues and things of that nature. And like Khadija was saying, getting back to the basics, going back to what our parents and our grandparents, our forefathers taught us as far as dealing with herbs and natural remedies, holistic measures to take care of ourselves. We definitely have to start those conversations, start networking and doing things like that so that we can start to be a little self-sufficient as far as the people, our nation, or just community-wise. Just not always having to depend on modern medicine. Like, I am a nurse in a field where we do a lot of medicines, medicinal, not medicines, but modern medicine. You know, a lot of chemicals go into those things, and you know, that's not what we're made of. We're not made of chemicals. We are made from all of the natural things that God gave us here. So to start those conversations in our family, in our homes first, and then reach out to the communities, reach out to those people who have those resources, people like Khadija who's growing herbs and supplying the community with things like that. We have to definitely push that more.
Okay, and let me ask you another question in that same vein. Um, what do we have in place, do you think, to involve the youth and keep them from some of the mistakes that we've made as older people in terms of ignoring our mental and physical health or well-being? How do we connect with them?
Now that's a good question. Here in North Carolina, being a part of the Hebrew family of Charlotte now, and I can only speak on our points, and as far as like what we have in place here, we have a very big community where we have some of our older brothers and sisters that take on that responsibility as far as getting our children involved. We have teachers, doctors, nurses, therapists, counselors, everything, and everybody is involved in making sure that our children are either involved in community and just being a part of and building this family so that we can communicate with one another effectively and help each other along this way. A lot of things, again, like I said, communication, we have to keep that thing open. We have to make sure we are communicating with our children, and of course, making sure we're careful about how, because things have changed. Although they say there's nothing new under the sun, we kind of repeating these cycles of things that we're doing. However, it's changed slightly as far as the challenges that they may deal with. Like right now, race relations is a big thing. Even just yesterday, another one of our brothers was killed. So these are things that we have to open up with our children. I have a 18-year-old son who may express like his frustration, but having that conversation and sitting down with him and not so much teaching him that you have to be so angry and this is how you go about handling the situation, teaching him not to be against other races, but how to be more for your people, help your people more. And it's not so much, we want to try to change the way we've been teaching them how to do in this place, in this society, where they're going to come across and they're going to have to deal with these different things, from race relations to healthcare to providing for themselves, being entrepreneurs, all of it. We have to teach them these things. And we do have resources. Like I said, here in Charlotte, in North Carolina, we have so many that are in different fields that are open and willing to help these youth. They hold different forums. We not only hold forums for them and have these open conversations and classes, but we even have times where it's a thing of play. Let's just go out. Let's have a sports day. Let's do this. Let's do that. We have so many brothers and sisters that stay on top of these children so that we can at least, even if we don't have the full setup for them, we could at least start to show them how to go about doing things, how to go about enjoying and being a part of a family, a community, and helping each other.
Thank you so much. Do you want to, if you have questions also, just please put them in the chat forum so we can field the questions to the guest presenters. I just wanted to ask Dr. Burton a question in terms of the research that's out there. The research regarding the health of Black and Brown people being disproportionately affected or infected by the virus. Now, I know a lot of times it's being said is where people live or where they learn or where they work that contributes to some of these conditions. Can you just elaborate on some of these conditions that really affect the Black and Brown population in terms of why we are being so disproportionately affected?
So there are embedded questions in that one question, because we are affected and infected. So there are a lot of levels to that. So first of all, COVID-19 or coronavirus affects the respiratory tract. It's a disease that is still very well unknown. And we get a lot of our official information and research from the CDC as it relates to communicable diseases. So we are required to try to do two things. We have to that is not always comfortable for Black and brown communities, and that is to rely on research. That takes time, and I know you know that it takes a lot of time. But in order to get research for a disease that you don't know, it will require a lot of data and information over time to be collected. And as you know, as it had been mentioned earlier, there is going to be a lot of difficulty with getting to penetrate information sharing, communication, like she said earlier. So right now, it's still new. This is still very new. In fact, the data is not accurate yet. If you go on the website with CDC, it's going to tell you about 33% of Latinos and about 21.8% of Black Americans are going to be those who have positive cases, which put white Americans about 34%. But if you read into the data, it's telling you only about half of the reports of positive cases and deaths include race. So that's not giving us a lot of information. So what you're hearing as it relates to our risk populations, as you know, when you're talking about Black and brown and minority groups and other groups of vulnerable groups, and when we say vulnerable, we're talking about anyone who is not likely to have access to healthcare to manage some of the non-communicable diseases that are putting people at risk. So that's the hypertension, the diabetes, and the asthma, and other diseases that affect communities of color a lot more impactfully than other groups, is because of access to information, access to healthcare, and preventative healthcare. And so when we're talking about impacts, it's a lot included in that. For example, they're saying that a larger number of people of color are gonna have your essential workers' jobs that are frontline. So they're gonna be your janitors. They're gonna, you know, it's estimated 74% of janitors out there are people of color. And in certain communities, they're gonna ride public transportation to get there. So, you know, it's such an embedded question. So I appreciate that question, but it's at this time, the reason why the focus is gonna be in places of color simply because the information we do have is that we have higher numbers of hypertension in communities of color. So even though we don't really have the full information yet, because the data that's being spilled in, that's being collected, doesn't all include race. So right now you can't tell, they can't tell you how many of the deaths were people of color. They can't tell you that yet because a lot of the data that's being reported doesn't include race. So only about 52% of the data that's being reported includes race. So that's a lot of missing information. But the reason why this is so invaluable is because we already know that the severe cases that lead to death are gonna be people with comorbidities, hypertension, diabetes, and older people who doesn't always necessarily have the same immunity to respiratory conditions such as this.
Okay. Let me ask Khadija, what are some of the natural holistic remedies that you can think of to boost our immune system during these times? I know there's some out there, correct?
Absolutely, absolutely. And I think it starts, the best way to battle this situation that's upon us is thinking about how you're going to maintain your health and boost your health. So one of the things when COVID hit the community and told us that the government told us we needed to stay home, my husband, who is one of the most health-centered people that I know, he gets up, he runs, he eats correctly, he does all the things by definition, and he got sick. And in getting sick, you know, with all the symptoms that came along with the fevers and the chills and the cough and so forth, what I found was that his ability to move and the things that he ate and created for himself was what helped to keep him healthy, and I do believe here. And so when we move to that space and we look at a concept of what can prevent, and we start thinking of herbs, and we start thinking of the things that we can drink, I first want to think about how do we change our behavior? And how do we change our concept of what my exercise is not about just getting an ab here or there or a new bicep, but it's about how do I exercise my lungs? How do I make sure that my organs are working correctly? What is the fuel that I'm putting into my body to support this process in which that we're in? And so some of the herbs that we use, one of the teas that in fact is a blend called the Mucosal Tea. And what we did was create a tea with another herbalist, and it's calendula, it is senna, it is lots of ginger. So just thinking of things that's going to help with circulation, thinking about the kind of foods that you eat that starts to build up mucus in your body. Are we eating too much bread? Are we eating too much rice? Is there an imbalance of green on our plates? Just all the things that we know to be the common sense value that we say to ourselves sometimes it takes a little bit too much effort to do. The effort in finding the greens, the effort in drinking the juices, the effort in drinking warm water in the morning and really creating space for the mucus buildup to happen in your body to just dissipate is entering bitters into our food. Like thinking about bitter greens, thinking about bitter tonics. How is that going to help fortify the liver and the kidney, which is the organs is helping to detox the body? And so I'm a person who really believes in Western medicine as well as Eastern medicine. I'll never tell anyone to, just give up on throw away your meds, because COVID came and exacerbated the things that were already there. Our community was hit by HIV. Our community is hit by diabetes, hit by hypertension. All those things were things that were in existence based on what it is that we been exposed to. So now that we're in this space again, looking at things like herbs that'll help flush out your bowels, thinking about from what you see to what you smell to what you taste as it goes down straight through the esophageal tract all the way out to what comes out. When we ask people simple things like, how often is your bowel movement happening? And they say things like, oh, like every 2 days, or every 3 days. Those are things that when we start looking at and we think of how we're keeping waste in our body and how when something comes and attacks our body needs to be able to fight. And if it's fighting things that like a tenant that no longer is serving its purpose, it's not paying rent anymore, it's not serving us, then we have to figure out a way how to get rid of that tenant and put in the fuel that should stay in our body. And so we can run through like lists of herbs, but to me, I think it's first coming to that space of the common sense value of what am I investing in? Am I investing in my health or am I investing in my disease? Whether it's COVID, whether it's hypertension, we've been hit many, many times as a community based on the things that come at us that has been quiet pandemics. It just now is a pandemic that is hitting the world, but we've been hit by these pandemics. And now we get a chance to say, I'm going to put myself first. I'm going to use my common sense value. I'm going to really think about, did that last sandwich that I ate, is that something that was just like a quick fix, or is it really meeting my my demise?
Thank you for that. Very insightful, very insightful. If you have questions, again, please post them on the chat box. Question.
Dr. Fatima, I just want to interrupt you really quickly. And I'm sorry about this, but I'm not sorry. So when I was 21, 22, I first met you. And one of the things that you encouraged me to do was to exercise. You would wake up, what I felt like was before crack of dawn, like, how we doing that? And I'm going to the gym, right? And now I understand, now that I'm almost 50, I understand the importance of why exercising and movement and a movement practice is important to my, not just my wellness, but my mental wellness. Like what happens when you are overwhelmed and you get into a physical practice, you can't sweat and worry at the same time. You just can't. Like you gotta, like if I'm like doing a push-up, I swear I'm not thinking about the rent. I'm just trying to get up into this push-up, right? And so the importance of really activating the connection between your physicality and your mental and your spiritual, that I think is like the medicine that we're gonna need to be able to ride this thing through. That's all. That's it.
Absolutely, and thanks for that, Khadija. A long time ago, I'm still trying to exercise, believe it or not. I've gotten a little late.
I believe you.
I'm still trying to exercise. There is a question from, I think, Mashaya. I think her name is Mashaya. She says, and I don't know anybody can, someone who thinks they can answer this, how will vaccinations go after this COVID pandemic? I don't know if anybody has anything to say about that, or if we don't have the expertise, or we want to put that question on hold for a minute, or anybody want to tackle it?
I know that from a community organizing standpoint and community education and just working in a high risk population, it's not the only one, but working with people with kidney disease as it relates to minority groups, is a lot of resistance to vaccinations because there's a lot of resistance to information. And that's why this is so paramount, this kind of conversation. Developing relationships. One thing that, we all relied on touch, and we relied on seeing one another physically. Well, this changes and shifts everything, doesn't it? Maybe this is actually going to help us reach a lot more people. And so we should take advantage of that as we learn the information, because there's a lot to learn still. It takes time to come up with a vaccination. Then it's going to have to take volunteers, and then it's going to, there's a lot to go into it. But just communication on vaccinations in general will be good information to prepare people for being open to vaccinations of COVID-19, because right now there's still a lot of resistance to the idea of vaccination.
Yeah, that is quite controversial, and we'll see how that plays out as we move forward. Some of it's justifiably, some of it is justifiable. I had another question regarding the rumors out there, because we have a lot of rumors and misinformation that's being spread in our communities. I mean, from the very beginning of this pandemic, Blacks were told that they were immune to this virus, that it doesn't affect them, it will not affect them. It's really just a rich white man's disease, those who globetrot from place to place. So how can we combat those types of rumors and misinformation that is is very pervasive in our communities? I don't know if Nurse Evans-Young want to tackle that at all.
Oh, no problem. I sure can. So my thing is, you can't believe everything that you hear, read, or see. And it's so funny as I'm looking at the questions on the side, and we had one about the vaccinations. It looks like Adashima, if I hope I said that correctly, said resistance due to historical reasons too. Lots of Black people don't trust people in the medical field. And that goes along with some of the things that they've been putting out there in regards to the COVID and Black people and brown people, the rates of what they are dying, they're immune, the way I see that whole idea where someone said that Black people were immune and they couldn't catch the COVID, I put that in the same category of right now with the riots and things going on. And they're saying that we're going for peaceful protests, but then all of a sudden it turns violent because they're putting certain people in place to start this violence that aren't of the cause to have these peaceful protests and things like that. Again, and that's where that distrust comes from, because in our past times, we see so many times where we were tested and we were used as guinea pigs for experiments. And, it's hard because now you want people to go out and trust that you've come up with this new thing. First, you said we were immune, but we see that now we're at the top of the list for people dying and people getting sick from this COVID-19. It's so hard to discern what's truth and what's not. What I will say about it is, let's be wise. We know there's something out there, whether you call it coronavirus or you call it COVID. We know and understand this is something that's real. And yes, we are affected by it. So let's be wise. Let's do what we can to keep ourselves healthy. Do the same things that they're telling. Like earlier I said, there's one extreme or another. It's either we have a group of people or so many of us that's like, oh, that's not real. It's all a conspiracy, this, that, and the other. Then we have the other extreme where people are staying home and they're secluded and keeping themselves in their houses, but it's costing them their own well-being mentally and physically because they can't go out and get things. We have to be smart about this. We do know and understand that this thing is very real. It's not going anywhere. It's going to be in existence from this point on, and only God knows what's to come next. So we have to just move wisely. Go ahead and put on those gloves, put on those masks, do the social distancing, do all of these different things that we need to do to keep ourselves safe and to keep ourselves healthy. But definitely we have to know and just be very, be choosy as far as the information. Do your research, do your own research, make sure you're educated. One of the things that Khadija was saying, oh, and I just love everything that she just said, but one of the things she did say about the physical, the mind, body, and spirit, one thing that you do have to understand is that even fear, setting out that whole thing and making us afraid, that fear that you put in yourself within, it affects you just the same. It's going to affect your health as well. Because if you could imagine, you already have this implanted in your head that, oh my gosh, I might possibly die if I catch this thing. So if you get the slightest bit of a cough, sneeze, or sniffle, it sets the body's hormones and it sets everything off. It sets everything off and it causes an imbalance. So we definitely be educated. Don't be afraid of what's going to happen, but be educated, be well educated, do your research, ask questions, and continue to, again, try to link up with people who may know a little bit more, network a little bit more.
Thank you. There is a question in the box about the legitimacy of sources regarding Black people being not being very, I guess, not really being very trustworthy when it comes to the information out there. And one person cited the Tuskegee experiment where, Blacks were just not informed about what was going on and using. This has been going on for quite a while, especially in poor neighborhoods, Black and brown neighborhoods. We're always the ones who experimented on. Now, Adashima mentioned something about a book called Medical Apartheid. And she said this is a book that explores all history and examples for why Black people distrust the healthcare field. So if people want to do some more reading on that, you can see the justifications why people feel the way they do in terms of, staying away from certain immunizations and things like that. There's also someone is putting out, I'm not sure if it's a rumor or what, that once the vaccinations do come to fruition, that they'll be mandatory. I don't know if anybody's heard that as well, but that's more information out there. I'm not sure how legitimate that is. It might just be more conversation where people are getting fear-based information, like Nurse Evans was saying. But there's a lot out there in terms of what we need to be aware of. There's a question from Miss Tutor, and the person wants to know, how do you get rid of mucus? This person said he's been having mucus for a long time. I think you mentioned it briefly, but I guess you can reiterate. This person has had mucus, a situation with mucus for a while. I think they were dealing with ginger and so forth and so on, but I guess you can answer that question.
Well, I think the easy answer is to get rid of something, you have to stop doing the things that's going to cause it. But the more responsible answer is to definitely sit with a practitioner who can take a full intake with you and see what it is that you're eating, all the things you're consuming, and how that is affecting your body. There's tons of teas, there's bitters. We do a bitter tonic here that is based in cascara, sagara, and neem that's very helpful. But I don't like easy fixes. And so I always encourage people to get with a very good healthcare practitioner, herbalist, that you can sit and speak with and say, these are the things that is happening, and figure out the different regimen of food that you're eating to help. Because most times mucus is really activated by what you're putting into your body and how you're not eliminating. So it's an overconsumption of something that's not getting out.
Thank you. There's another question for Khadija. can you recommend about growing in the backyard? This person's, I guess maybe, I'm not sure where they're located, but something that doesn't require a lot of maintenance.
Everything requires maintenance, y'all. Everything. That's what life is about. But I've been growing rosemary and bok choy and citronella and just all the herbs. But more so than just the easiness of it, it is something that was keeping me quite calm in this time. Being able to put my hand in dirt, it was a very therapeutic value for me. I wanted to just skip back over to this concept of rumors, right? And so there's always a rumor that's going around about something. But in this time that we're in, we have access to information way, way, way faster than we've ever had before. Before, we would just hear people talk about stuff and we were like, oh, okay, you know, brother so-and-so said something, or brother, you know, sister said something, right? But now on our Instagram, on our Facebook, on our whatever, you know, social media platform, we get access to every truth and lie that there is, and it becomes overwhelming. And so how do you deal with that? You start listening to what this information is doing to your emotions. It's $20. What it is, I'm also selling plants, right? So what it is, what all this information does to your emotion, you feel it, and then you have to start thinking to yourself, should I filter out this experience? And so I don't really stay on social media more so than to post the things that I need to, and I go to the places that I trust that says, these are the things that really helped me to understand what I'm doing. And I read and I read and I read, because all the information that you need, it's coming out so quickly, but you could decipher. We got common sense. You know, I don't really feel like the aliens are coming today to come and kill all the Black people, but I do feel that the things that we're doing to ourselves and the things that the stress that we're on and the trauma that we're under, that is really what's murdering us at a rate faster than we could ever think of. And so going back to my plants, any plant is going to need your attention just as you need attention. Plants are just like people. It needs light, it needs sun, it needs attention. So from that space, you know, go from there.
Okay, does anybody else want to ask a question or chime in, or something that they have a burning question they want to ask?
I would like to ask about vitamin D to the nurse. Now we know that, or maybe we know that we suffer with a lack of vitamin D. And I read a report that vitamin D, because people of color, they lack vitamin D, and vitamin D helps the respiratory system. Can this be something that we could add on to our list of building up our system? This is to the nurse.
Well, vitamin D, I mean, a lot of times they'll tell you the best source of vitamin D is to go out there and get you some sunshine. I don't know as far as studies that show that we lack vitamin D more than anybody else. However, it wouldn't hurt. But I will say, as far as supplements and things of that nature, whether it's vitamin D, A, C, you have to be careful sometimes, because supplements that you get off the shelf, sometimes your body cannot process those supplements. It takes another supplement for your body to take it in properly and excrete it properly. So you have to be careful if it's not a natural form of vitamin D. So I would definitely say you can use any, but I would caution you to take in a supplement without knowing what your levels are. So the first thing you want to do is get those labs and find out what your vitamin D levels are, because you don't want to take in too much of anything. Too much of anything is not a good thing. So find out what your levels are before doing such a supplement. But again, if you have to, or if you feel like that's something that would be helpful, and usually if you come in and they say, oh, your levels are low and this is why you're feeling tired or so and so, they will tell you to take a supplement. But again, a little caution to take in supplements that are from off of the shelf at the pharmacy, at your nearest pharmacy. If maybe Khadija, and I'm throwing you in here, can give us some ideas as far as natural herbs that'll help with building up vitamin D. That will be your best bet, because natural herbs and things of that nature are better than taking the pills off the counter. Again, sometimes your body have a hard time processing those things or the byproducts after taking in what it needs to get it out of your body.
Right now, everyone is speaking about sea moss. I'm sure you all heard sea moss is the whole miracle of everything. You can't find sea moss because it has all of the vitamins and minerals that we all need in our body. That being said, just to agree with common sense again, you can hear things about vitamin D, you can hear things about vitamin K, you can hear everything that you hear is not necessarily for you. Now, if you're not having a healthy engagement with a practitioner who understands your body, understands that they can hear you and say, here's the things that's happening with me, and these are the things that happens when I do X, Y, Z, just looking and seeing something online that says you should ingest any kind of vitamin or any kind of sea moss, or, you have to really make a commitment with someone who's professional to say, this is what's happening with me. And they can say, okay, well, this portion of what we're doing, this is what you should do. There's an amazing doctor, Dr. Kakai, you can find him online. He is Western as well as Eastern medicine. And he also is a person who prescribes supplements, yes, but it's really based on what's happening with you in particular. And I call his name because I'm seeing so many people here who are my elders who have guided me into being who I am today as a healer, but more so as a woman who can have a ability to make conscious decision based on an assessment. And so I say this to you and whomever is wondering about what vitamins or what food or what herb you should take. It's not just about the research of what someone else is doing, because right now everyone is trying to sell something amazing. I have a bag of this, and if you take this now, it's gonna fix it. And that's a lie. If Dr. Sebi said to you, you should only do this, but your body doesn't work with Dr. Sebi's process, then that's not for you. If you're a vegan and your hair is falling out and you're feeling, your skin is feeling sallow and then that's not for you. Like, you have to really be conscious about what each and everything that you put in your body, each and every fuel that you put in your body is for you. So always check in with a professional, a one-on-one.
Thank you.
Great advice. Great advice. Another question for Khadija. Seems like wanted to know about the soil. How do you determine what good soil is to grow, like, say, your favorite herb or something like that?
I fell in love with worms, y'all. Like, I don't even know how this happened. I like worms, right? So you're always thinking about soil that has enough drainage, that it has enough. We have in our greenhouse now, one of my sons started doing worm casting and doing composting. So you're just thinking of, there's tons of stuff, but you want something that has a bone fertilizer inside of it. And if you go to any good nursery, or honestly, any good Instagram page right now is worth their weight on. You can get all the information because everybody's a farmer right now. We all have nurseries in our house. We grow. I'm taking pictures of people's steps, and they have so many herbs just along their steps. So your soil portion is when you start looking at whatever it is that you're growing, whether it's potatoes or beets, just start thinking of what has enough oxygen in it. Is there enough fuel that's happening that's coming from your compost that you put in? And if you're not making it up, and like me, who wants to be ridiculous and have worms in my backyard, because I do, you can definitely there's tons of bags of soil that you don't have to spend a whole lot of money on it. Any really good soil worth its weight that any good nursery is going to do.
Thank you. I want the panelists to make sure they put in the chat their information, or they email someone wants to get in contact with them, or where their business is located. You put it in the chat, we will definitely share it with others on our website and on our Instagram page as well. We have, let me see, another person is asking about, Claudia, how are you connecting your efforts to the community and other communities? In other words, what are you doing to connect the efforts that you're making with other communities, if you understand that question?
I don't.
Okay. Anybody Anybody?
No.
So I can jump in.
Mm-hmm. Dr. Burton?
So I think that what I'm hearing is that, right now we have a lot of connection, and that's great. That's great among us. And we think about all the information and rich data that we're sharing. I think that one of the things that we can do is begin to think about how to create opportunities to share this information. How do we disperse information? Because it takes a long time for people to hear information, and like it was said earlier, to make sure it's true information or accurate information, and then to ensure that the hearer is believing it. So it takes a lot of relationship building. So if it doesn't already exist, that's something we can create. If you're not already aware, in the nonprofit sector, there are funds being allowed for you to apply for, developing settings where information can be shared among minority groups to make sure that they're connected, to make sure that there are rides to get to some of these places that provide affordable health care, and making sure that people get the information they need. Someone mentioned earlier about the food deserts, and so we really need to find a way, and if not, design a way and partner in our local communities and faith communities to develop settings where, partner with schools and making sure that they have access. Can we do a rally where there's a way to distribute face masks and hand sanitizer and information where young people can have the data and the knowledge that they need to know how important it is to drink water and to, other things that we take for granted. Even young people who are early in their careers to enroll in health insurance. You're talking about having to see a professional before you dive into medications. You got to see a health professional. And you don't have to wait till you get sick before you see one. Because a lot of times in minority groups, we don't go to the doctor unless we're sick. And sometimes that's usually too late. So those are great questions that I think that this setting is designed to answer.
Okay, I think we have room for one more question because right now it's 3:23. But we want to know, how important is it to develop a care plan? And by a care plan, I mean in terms of summarizing your health conditions, your medications, your health care providers, your emergency contacts, end-of-life care options. I don't know if people are doing that. Is there a need for that? What do you think in terms of that, Dr. Burton or Nurse Evans?
Well, when we're talking about Black and brown people and groups of minority where only a generation ago we didn't have access to the knowledge, we almost have to, first of all, there's a lot of guardedness between generations concerning health. Young people may not always have the information that other people, even us, have. So we need a way to ensure that they know what we're saying and they know what we're talking about, and that it's not the hidden secret that someone in the family has a disease, that they could potentially inherit one day. It's got to be a lot more, we have to be more receptive to the conversation. And I think that places of faith and dinner tables are a great place to start. Just a place where you have an opening ear. Now, when it comes into end-of-life planning and social work services, that's a communication in healthcare, and I know that the nurse knows this too. It's a conversation we have all the time, particularly when you're talking with groups that are high risk for premature death. It's a communication we're having all the time. But as you can see, there are people who contracted COVID-19 and died in 2 days. So people are not ready. So we need to make sure that your state level council on aging websites where that information is free. And if you can go on and you can look at your healthcare power of attorney documents, and you can go to your local places to get it notarized. You can get it and ask questions with your health professionals. So that's a starting place.
Thank you. Anybody want to add to that?
If I may, like Dr. Burton was saying, there are those questions of end of life. That's a big topic that's sensitive, especially in the Black and Brown community. But is, like I said earlier, communication, opening those lines of communication and starting those conversations. We definitely need to do that. We see way too many times where there's an unexpected death in families where everything is just such in turmoil because the person didn't have those things in place, didn't have life insurance, or didn't have a burial plot and things of that nature. We definitely have to start those conversations and stop shying away from things like this because, I mean, death is inevitable. It's going to happen to everyone. So it's one of those things that's not supposed to be a sad conversation, but again, keeping yourself aware and knowing what's going on, understanding what your partner or your son, daughter, mother, auntie may want to have in place in case something happens. That's so important. And it makes it much smoother. It makes it much smoother for the family, for you who have to endure the loss. So these are conversations that definitely need to be started. And like Dr. Burton said, the table, right at the table in communities, we have to start these conversations and keep it an ongoing conversation so that we don't continue to shy away from these things. And as far as the healthcare and just getting started, go to a doctor's office, know your numbers, know what your A1C, which is in relation to blood sugar levels, is, know what your chemistry, your body chemistry is, know all of this information. So even if you do decide whether it's going to be modern medicine or holistic medicine, you have to know what you're getting into, know your body, know yourself.
Thank you. Thank you again. We're going to basically start to wrap this up. We really appreciate our distinguished panelists or guest speakers. They had a tremendous amount of information that they disseminated with the group. And there's resources as well that they included. So we want to thank them on behalf of Friends of Bright Minds. Again, this presentation is taped. So if you go to our YouTube, you'll see this video in a couple of days. It'll be up so you can actually view it. We are going to continue doing what we're doing, the Friends of Bright Minds. We're going to be giving these informational series out. This is like our third or fourth one. The next one we're going to be doing deals with the social unrest that's going on in our communities and looking for some strategies and things that we can utilize to help assuage some of these issues that are happening in our communities. So that's going to be the conversation. That'll be approximately in 2 weeks. And then we're also going to examine the educational arena in terms of what is education going to look like? What are the schools going to look like come September? That's a question that we're asking. Are students going to go back into the brick and mortar buildings? Or there's going to be some kind of a hybrid instruction where students will be getting different types of instruction from home and also maybe in the schools? We realize that there is a disparity in terms of education as well. And with this distance learning, a lot of our students, especially in the urban centers, the under-resourced communities, were completely left out of that distance learning where they didn't have computers and they didn't have routers to give them internet access. So we have to take all this into consideration. So we're going to be doing a webinar on that sometime within the next month, and we're going to be looking at how some of our Black and brown parents have decided to be homeschoolers because of the this is something that they thought it might be more effective for them as parents. So we're trying to stay ahead, and we're trying to stay on the cusp of what's going on in our communities. We ask that you spread the word what we're trying to do. We also have a link where you can also donate to what we're trying to do so we can continue this. We do have programs that were scheduled coming up in the fall. And even though we have this COVID crisis going on, much of our programs and many of our programs will be in a virtual setting. So we do thank everyone for coming along and being a part of this presentation. And more importantly, thanks to those three wonderful, distinguished panelists Thanks for disseminating such reliable, great information. Dr. Burton, Khadija, and Nurse Evans, thank you so much on behalf of Friends of Bright Minds. Thank you.
Thank you for thank you for those who tune in, and thank you for our presenters. You did a wonderful job, because we have everything in our community to make a better world. And that's through education. That's what we're trying to do. Build a better world, reaching out to what we have and passing it on, passing the information on. So thank you very much.
Thank you.